Hello, I'm Rashil, and my speech is on organ donation. And did you know 6,500 people die each year in the United States because their failure to receive organs? I volunteered this summer, last summer, at Houston Methodist Hospital and also at the Children's Hospital in the medical center area. And I noticed, and it was one of the saddest experiences of my life because I would volunteer at the liver center and also would volunteer at the kids hospital, and I would see all these patients waiting on organ donations, and their families would be just on the edge, just waiting for them to get back word from them because they're slowly dying. It's really sad. And according to the U.S. Department of Health and Human Services, 123,798 people are on organ donation waiting list right now, and there's only 8,277 donors this year. This year is going to be it's going to be the most fatal year for the United States for these patients in the history. And according to H&H department, every day 21 Americans are added to the waiting list. And previously, just in 2003, this number was only 12 people in comparison. And just to show you how much the needs have magnified, DMV states that 40,000 patients are added are on more on this list this year than they were in 2008. So that kind of should give you the magnification of the problem. And the lack of organ donation hurts the patients and the community financially. We don't really think about it this way, but it really does. If you had to get a heart transplant, the average cost that takes is $997,000. And if you want an intestinal transplant, it costs $1.2 million. And this includes cost of when you're waiting and receiving medical treatment just to keep you alive until you get the donation, and then the transplant costs. And a lot of the times, these procedures don't go through. And well, there's an easy way to solve this problem. This problem can be solved by the community organized like efforts. And the fastest way to do this is implementing organ donation drives, where they would have similar to the blood drives given by the Red Cross. They would have organ donation signing up lists where people would come to colleges and they would educate colleges, campuses, and even high schools and educate the students on what organ donation is and what they're required, how they're required to do it. Another thing is they should use organizations such as Donate Life and use government funding to fund them to have these sort of events that educate the public. And one of the better ways to do it is also to use. The biggest problem with organ donation is oftentimes people feel that it interferes with their religion or their spiritual beliefs. But in reality, it doesn't. It's by religious institute, organ donation is seen as more of a charitable act, and that's why they should educate spiritual leaders such as priests or this following to educate their public, because it's an easy way for them to reach out to their community. And one of the bigger arguments is against funding organizations, private organizations that promote organ donations, because people feel that it's a waste of money. But it really isn't, because government spends a ridiculous amount of effort and financial effort when they're paying for these organ donations to occur. And it's literally too expensive for our government, and it's one of the biggest expenditures for our government, and we're really in deficit right now. And by having readily available organs, we can reduce the cost of transplant patients from 60 to 70%. So that would just include just the operational cost, which could also be reduced by implementing surgery researches. Groups between organ donation. Excuse me. Okay, so having readily available organs could really affect our economy and our personal well-being. United States will be seen as a healthcare hub that is unparalleled by any other nation. We currently are, but this would take it to another level. According to the U.S. Library of Medicine and National Institute of Health, a procedure should cost only about $123,000 after we have readily available organs, and this would be seriously reduced because we would have enough research done because of the readily available organs to effectively provide healthcare to patients. And they have guaranteed that with enough time and research provided, they could allow one person to save 8 different lives and improve hundreds of lives by the donation of tissue grafts. And so this is for like burn victims and stuff. Actions. The easiest way for you to take action is go to donatelifetexas.org/register, and all you do is it's going to take you less than a minute. You just go, put in all your information, and you sign up for it. And the second part of the procedure is you inform your loved ones about your procedure, because even if you sign up as an organ donor and in an unfortunate event you pass away, your family is also the ones who decide whether or not your organs get to be donated, even if you were signed up as an organ donor. Do you have any questions?
Are you an organ donor?
Yes, I am.
Good job.
What made you want to volunteer at those hospitals?
I currently want to become a pharmacist, so I wanted some healthcare experience. Thank you.